I had a young woman I was working with when I was a child and family therapist. We didn't just deal with her mental health presenting issues. We didn't just deal with her lack of exposure to different narratives for being Black. And we didn't just, send her off to a camp or something and expose her to, oh, this is great, and then leave her alone. We advocated for her when it was necessary.
Being labeled as crazy as a Black person, it's very traumatic.
With me, I have PTSD. My experience is being re-traumatized by the therapist.
I came up to Portland to work at one of the larger agencies and was one of the only African American males providing direct service. So there was a huge need in the community for African American males to provide service for mental health.
If you put two children together, one child who is a Caucasian child and then another child who is African American or even a person of color, and they both was diagnosed with ODD, you would see that they react differently, which makes me think that it's not ODD. And I just wish that there was more education or more research on how to deal with this situation.
We have a mental health crisis going on in the state of Oregon, and have had it for some time. It's based around the resources that we have available or not that are not available. It is especially key when you're talking about the African American community.
I was diagnosed back in 2008 with bipolar. At first I didn't know what it was. I had to have like a trauma, like a bad experience to know exactly what bipolar was. Back in 2012 when I went to the Oregon State Hospital and I got to learn more about bipolar. So I really got to know like it's hereditary. Like at first I thought I did something to myself for it to happen, but I was born with it.
Community Alliance of Tenants, we serve low-income tenants and people of color, which ranges from immigrants and refugees to people who are African American, folks like me. And the biggest impact that we have seen is a loss of stability, and our community is completely and totally ripped to shreds, especially when it comes to African American communities. The biggest thing that I've seen is that people feel disconnected, people feel disjointed, people feel there's no sense of community or like place that they can go that belongs to them. People are traumatized because of the loss of the loss of memories, the loss of landmarks, the basically what's called root shock. The ground has been taken or stripped from underneath them in a very traumatic way, and so people are just frustrated. I've heard of people in my community talking about every time they go to Mississippi Avenue or every time they go to Martin Luther King Jr. Boulevard, which is where our people settle the most in North and Northeast Portland, their blood pressure goes up because they're just sick and tired of seeing how much it's changed and how none of the changes benefit them.
With African Americans, if you have a small community, we all know each other. And unfortunately, 9 times out of 10, we all know who that supposedly crazy person is. So just to have that label is enough, but to also have the community know that you are seeking services, it's shameful too.
So if you want to have change, focus on the direct links to the people who influence them the most. And sometimes that's influencing them to get mental health needs, assistance if they don't want to. That's them saying, somebody who they value and respect saying, maybe you need some medication to even out those chemicals that seem to be off, and there's no shame in that.